thank you for having me here today, for having us here today. I really appreciate it. Thank you for the invite, Jackie. I too would like to acknowledge the traditional custodians of the lands on which we meet today. NOFASD is a national organisation, even though I'm based on Wodjak Noongar Boodja over in Perth. And I would like to acknowledge the Kaurna people of the lands that we meet on today. So I'm not going to talk about NOFASD now. I'm going to talk about that a bit later, but what I will just say, we are the national peak body for families and individuals affected by FASD. And our aims are to improve the quality of life for individuals. And that means networking and working around systems and to help generate that support, but also to help prevent alcohol-exposed pregnancies. So what is FASD? You're going to hear a lot from Professor Elliott shortly. So my presentation deliberately is not talking about a number of statistics. There's only a couple that I will mention. But in terms of a wider description, I do say this very frequently, but I'm going to read the international standardised definition. So fetal alcohol spectrum disorder is a diagnostic term used to describe impacts on the brain and body of individuals prenatally exposed to alcohol. FASD is a lifelong disability, and individuals with FASD will experience some degree of challenge in their daily living and need support with motor skills, physical health, learning, memory, attention, communication, emotional regulation, and social skills to reach their full potential. Each individual with FASD is unique and has areas of both strengths and challenges. So I just really wanted to mention that, first of all. The only stats I will say in this section are really to look at the prevalence and to challenge the stigma that often relates to FASD. And that's why, as a national organisation, we talk a lot about stigma and lived experience and sharing those experiences. I won't go through each of these stats. You can see them online and for those of you in the room. But I think it's really important to contextualise when we talk about FASD, particularly when we're in an environment where we're talking about dependence and alcohol use disorders, to really look at the broader population as well. So FASD can be anywhere, wherever there is alcohol that impacts a pregnancy at any stage. So FASD is often a hidden disability, and there are distinctive characteristics, whether they're physical, developmental, neurodevelopmental, or apparently behavioural. And FASD really is a spectrum, which may often not be seen at birth. And anyone in the room who knows a little bit about FASD, they will know that there can be characteristic facial features. I won't be talking about that today, but it's a very low percentage. So around about 90% of people don't have facial features. And I think that's a really important thing to know, because a lot of people will still tell me that it's all about the facial features. It is highly stigmatised. I think it's one of the most stigmatised disabilities, and research is out there in the community to support that. And yet alcohol is so widely used as a social lubricant in many, many forms, or because people don't have a choice around the use because of dependence. So it's really important that we have that consideration. We've seen the stats that Jackie's already shared with us in terms of alcohol use in Australia as well. When we talk about FASD, the language is incredibly important to help prevent that stigmatisation. And you can visit the FASD Hub or NOFASD Australia, our website, to look at the Australian language guide and the ways to, it's a really good idea just to refresh our memory. I know every day that the language in the FASD space can be updated. So it's a really good idea to have that refresher if you have an opportunity to do so. And there are many secondary challenges that overshadow that primary disability, that brain-based disability. So it's important that we have a better understanding, and I'll talk a bit more about that in the next section as well. And you are part of that journey when it comes to helping to remove the barriers to diagnosis, but also to recognising FASD in service delivery as well. Very quickly, because I've now got 2.5 minutes. See, I told you I can talk too much. This is my son. So to give context, I joined NOFASD Australia just over 8 years ago. I only moved into the CEO role just a year ago now. And when I joined, I didn't join because I thought my son had FASD and I had lived experience. I joined because I'd worked in a number of different sectors and thought, oh, I know a fair bit about FASD. And then when I joined and did my research, realised that my eldest son, biological son, could be living with FASD. 2 years fast forward, he was diagnosed and he is severely impaired in 5 of the brain domains that were assessed. We only had 5 assessed. So he's now 20. He's gorgeous. I love him to bits, and he's a very active and, I'd like to say, thriving young man. but that's because we're really fortunate as a family and we haven't had to deal with intergenerational trauma or current trauma. I haven't had to work through the journey and the additional stigma of substance use, and all of the many factors, so many protective factors in our life that we've been very lucky to have. I'm going to really quickly flash through these. All I'm going to tell you is he was born full term, good healthy weight, 9 out of 10 on the APGAR scale, if that means anything to anyone in the room who's had a baby or knows of those scores. But there were many factors throughout his life that we could have picked up on had we have been FASD informed in those early days, or if any of the clinicians that we'd come across were FASD informed in those early days as well. So his journey really started around FASD, as I say, when I joined NOFASD. But when he got to the age of around about 10 or 11, when we really couldn't do anything more in our lives with our normal knowledge and support that we had to be able to structure the supports around him, that's when we started to see things really change in the systems around him. And I was told many times, and I've heard other people say gaslit. That's not the word I would use for my journey. People, I believe, were intentionally trying to support, but just didn't have the information. But many times across that journey, we could have identified that my use of alcohol in the first 6 weeks of pregnancy before I knew I was pregnant could have been a causal factor for the behavioural symptoms and his learning challenges that we experienced. I've got 30 seconds. The barriers and stigma are immense. This is a survey that we ran online with our families, so it's not research-based or an evidence-based point of view, but it comes from families and their experiences. So I'm going to skip through. But knowing that families often are the people who really know the individuals in their lives the best, being able to connect with them and learn from them is vital. That lived experience voice is crucial when we're looking at systems and service design and how to support individuals with FASD. See, told you. I'm going to very quickly just take 2 more slides, I promise. But talking about reducing awareness, you'll hear from Jackie and myself in a little while around the Every Moment Matters campaign, which has been led by the Foundation for Alcohol Research and Education. They're vital in terms of having a campaign to make that difference, but also leaning into the lived experience, the research that's happening around the country more and more often now, which is fantastic and so exciting from a lived experience base to be able to utilise that evidence to support the anecdotal evidence we have every day from the families we engage with. And just one slide I'm going to share, and I'll share it in my next presentation, but it's about September awareness. And in September, if you can do anything, if you leave here today with one message, it's about talking about the conversation related to alcohol exposure in pregnancy in a non-judgmental, non-stigmatizing manner, so that we can have these conversations and bring them out into the open and get the support for people who need it. Thank you, and I will be